Welcome to the 2022 Head and Neck Cancer Survivorship Symposium, developed by the Head and Neck Cancer Alliance and the American Head and Neck Society. Our session is Managing Stress and Anxiety. I'm Dr. Liz Cash, Associate Professor and Director of Research and Health Psychologist at the University of Louisville School of Medicine in Kentucky. I want to thank our survivor panelists, Stephan Cassidy, Gail Jackson, and Dr. Mike Murphy, as well as our caregiver panelist, Kristi Mason, for joining us. Today, our panelists will be discussing their head and neck cancer journeys and how they managed the stress and anxiety of treatment and survivorship. To begin, we'll start with some brief introductions. Our first survivor panelist is Stephan Cassidy. Steve is a Navy veteran who was diagnosed with stage 4 tongue cancer, for which he underwent radiation and chemotherapy treatments. Less than a year later, he experienced a recurrence with the cancer spreading to his lung, ribs, and liver. At that point, he entered a clinical trial where he received both chemotherapy and immunotherapy. He has since been cancer-free. Steve, thank you for joining us.
Oh, hello. Thank you, Dr. Cash. I'm glad to be here and talk a little bit about my cancer journey in the context of stress and anxiety. Thinking out overall, I had stress during the cancer treatment. My anxiety kicked in more after the treatment and getting back to life. But as you said, my cancer journey is about 5 years now. 5 years ago, I was diagnosed with invasive tongue squamous cell carcinoma. I had a tumor 7 by 6 by 7 centimeters on the base of my tongue. I went to the VA for all my treatment and diagnosis. The diagnosis part of it was a very difficult and long journey. The one wasn't really difficult, it was long. It took about 11 months to diagnose it, many trips to doctors, ENTs, general practitioner, and otherwise. Very difficult to diagnose. I've been scoped twice and they didn't find it. And eventually my general practitioner got me a CAT scan and they discovered it. The hardest part of it was telling my two boys, who were both in high school, that I had been diagnosed with cancer, because it was the first real cancer in our family and didn't know what was going to happen. So the part about it too that was stressful was I required a feeding tube. The pain and discomfort to my throat and ability to swallow and eat was pretty much gone. So I got a feeding tube probably about 20 treatments into my treatment. I had the feeding tube for a total of about 8 months, I believe. But I got through the treatment and I got PET scanned approximately 4 months after my treatment was finished, somewhere around there, and got a clean PET scan in November. And then the following May, I was out playing golf with my son and I felt a twinge in my back that I thought I pulled a muscle or did something to a rib. Lo and behold, after another long 10-month, 11-month diagnosis cycle with many doctor appointments to physical therapists and chiropractors and my GP a couple of times, found a tumor on my tumors, one on my liver and tip of my liver on the bottom, and a large tumor on my ribs attached to my lung, and the tumor on my ribs ate through 2 ribs, and that was the pain, was basically broken ribs. Back to the VA for treatment. This time it was 20 radiations and 6, I believe, chemotherapy cycles. That chemotherapy cycle also did have one of the 3 drugs they gave me was an immunotherapy drug on its own. So I finished the care. I didn't get a clean PET scan. I got a stable PET scan. So the tumor was just there, sitting there, not doing anything. And when we finished the treatment, I asked my doctor, what do we do next? My oncologist, what we do next? And she said that we wait for it to come back. I asked, is there anything we could do? In the meantime, she said that I could explore opportunities out in the commercial sector, across the street, really, right near the University of South Florida where I live, and went to Moffitt Cancer Center for a consult about another options. And the doctor there, the head doctor at the ENT clinic, head neck clinic, said I was a candidate for a few different trials. And the one we selected was where it was 2 immunotherapy drugs given simultaneously. Whereas back at the VA, I could get each one of those drugs individually. I couldn't get them combined. So that was the element of the trial. It was a phase 2 trial with about 40 people in it, I believe. And got through that. 2 years of immunotherapy, treatment every 2 weeks. And that was 2 years ago. So there's a lot more to that journey and hiccups and bumps. But all along, I managed the stress and anxiety. As I said, it was stressful going through the treatment and the diagnosis, but getting the cancer treatment wasn't anxiety driven for me. The anxiety came in when it was all over, and I asked, and the world hit me again. So I can expand a little bit on more if there are any questions about that, on how I did that. I had a counselor. I journaled in Carrying Bridge. I stayed very physically active, including adding Tai Chi. And of course, my family, friends, and church were extremely supportive. So if we could, then back to you, Dr. Cash.
Thank you, Steve. Our next survivor panelist is Gail Jackson. Gail is a retired psychotherapist and survivor of HPV-attributed tonsil cancer. In early 2018, Gail underwent robotic neck dissection surgery to remove the tumor, as well as 42 lymph nodes, and then she also received a skin graft. 6 weeks later, she underwent proton therapy. Gail, thank you for joining us.
Hello, and thank you for having me. And that biopsy did reveal that I had head and neck cancer, left tonsil cancer, HPV-related squamous cell carcinoma. And then the journey began. I couldn't seek treatment locally because I live in a smaller town, and they weren't very familiar with this particular kind of cancer. And they were very honest in saying that it wasn't their forte, and suggested that I go to Penn. So I went up to Pennsylvania Hospital, University of Penn. When I look back at it now, I mean, it's been 4.5 years. When I look back at it now and we actually have pictures, it seemed like such a major daunting process, and it was. But I think that ultimately, when we don't think we can endure, we do endure. So I would say to anyone, we can get through things, but certainly we have to work through some of that anxiety and fear. Ultimately, what I would say for me, when I talk about stress and anxiety, being a retired clinician, I always used to work with people and talk to them about using their toolbox and developing a toolbox with the things that would help them get through whatever their challenges might be. And for me, that has always been family, faith, a support network. One of the first things I did that I suggest people not do, though, when I found out about the cancer, was I went on that whole Google search and went down that really bad rabbit hole, which is not the best thing to do, because if you read all the literature, you'll think that you're not going to wake up the next morning. So I think one of the first things for managing the anxiety and the stress is not to get involved with all of the literature, because everything doesn't apply to everyone. So support, when I did go through my search, I did find the Head and Neck Cancer Alliance, and that was the beginning of a major support for me. I actually reached out to Jason, who's on the board of the Alliance, and he was really supportive for me. I know that everyone might not have a traditional family or a church home that might be a support for them, but there should be, in most cases, with most cancers, some kind of support group. And for me, the Head and Neck Alliance was really helpful. And there were times when I would call Jason and he would just kind of settle me down, because, it was all new to me and he had already been through it. So I always say to people, for handling stress and anxiety, you need to have an adequate support, a support that will just help you to kind of stay on target as best you can. I would also say family, if there's family that you can reach out to. For me also, exercise is really important. It helps me physically and mentally. Also, I always talk about humor. And I know when I say that, people probably think, well, there's nothing humorous about this process. But for me, if I stay and this is just my journey. For me, if I stay in a very solemn state or something that seems really dismal, then that just makes it worse for me. So I have to kind of try to find some balance that has a little humor in it. So when I was still working, actually, one of the things that happened when I had a trach and I had a feeding tube, and then I did 30 rounds of radiation. But in the middle of that, I was still trying to see some of my clients, and I was seeing kids at the time. And so after I got the trach removed, my throat was always really dry, and it still is dry. But I would sound like Donald Duck. And the kids would say to me, Miss Gail, you sound like Donald Duck. And I would just banter with them that, yeah, you know, Miss Gail's been through a couple things, but, you know, we're going to keep it moving. So I try to use some slight humor, but not morbid, because it's a serious situation. But for me, that's what helps me to keep it moving. Let's see. Also, exercise, attitude. Attitude is really important. And I know that if a person gets that diagnosis, you know, the C word, the first thing they think is, oh my God, it's the end. But I think you have to kind of stay as positive as possible and not think that it's the end, because we're still here. You know, doesn't particularly mean that when you get a cancer diagnosis that you're not going to wake up the next morning. More than likely, you're going to wake up the next morning, and you have to figure out how to handle it going forward. So support group, attitude, a little humor for me, and this is my journey, a little humor, and also I think embracing your strength, because I have found that even though it's a daunting process and it's been hard in some ways, it has strengthened me and made me realize how strong I really am. And I think that if people step back and look at what they've been through, they would also see how strong they've been as well. So you have to embrace your positives in spite of this daunting task.
Thank you so much, Gail. Our next survivor panelist is Dr. Mike Murphy. Mike is a neuroscientist as well as psychiatrist at Harvard Medical School. He is an HPV-attributed tonsil cancer survivor. Mike underwent both radiation and chemotherapy for his treatment. Mike, thanks so much for being here today and for sharing your story with us.
Thank you very much. It's my pleasure. As I think about my own experience of cancer and how depression and anxiety sort of intersected with that, a lot of what the other panelists are saying really resonate with me. I think there's some common threads. For me, my story begins in May of 2020. I woke up one morning with a really mild sore throat. And to be honest, normally I probably would have just ignored it. But this was the early days of the pandemic, and you couldn't go into work if you had a sore throat. And so I did a lot of sort of saltwater rinses and stuff like that, thinking it would go away in a couple of days, but it didn't go away. And after 2 weeks of antibiotics, the pain went away, but I began to notice a lump growing in the back of my throat. After about a week of this, the lump got so big that it came to the point where I couldn't really sleep on my side anymore because it stopped me from breathing. My wife was really concerned about the new snoring, and at her kind of suggestion, I went to the urgent care to have what I thought was an abscess be drained. At the urgent care, they couldn't drain it. They sent me to the emergency department. There, the doctors tried to find any sort of fluid they could in the mass, and they couldn't. And they said, okay, well, we'll set you up with ENT tomorrow. They'll probably want you to get a head CT. Let's just do it now. So I said, sure. I got the head CT, and I don't know if you've ever been in an emergency department, but it's often a lot of waiting. So I was sitting in the emergency department waiting, and I was able to check my own records on my phone. And eventually the read of the image came up, and it had this little red exclamation point next to it. And I knew from experience that's a bad sign. And so I clicked on the image, and I saw cancer, and I was completely stunned. I had no suspicion it was going to be anything like this. I remember thinking, oh, this must be a mistake. I'm going to look up the doctor who wrote this read, thinking it was some new, fresh doctor. But it was actually the head of the department, very, very experienced. And then I had to face the fact that I had cancer. So that was when I first encountered anxiety. I had some kind of cancer. I didn't know what it was. And like Gail, I went into Google, and there's all sorts of different cancers with different treatments, different prognoses. And, I was 39 at the time. I had a 5-year-old and an 8-year-old. And immediately I began thinking, well, what would happen if I wasn't here? What would my wife and children do? I relatively quickly got connected with the Dana-Farber Cancer Institute, where they diagnosed me with HPV-attributed Tonsil Cancer. And that was, okay as far as these cancers go. The prognosis is pretty good, but the treatment is quite grueling. So to get radiation, what they do is they strap you down to a bed, and this machine spins around you while you're kind of lying there for 5 or 10 or 15 minutes. And you might think that with cancer, that would be the only thing you worry about, but I'm actually a little claustrophobic, and being strapped down while this giant machine fires radiation at me, it wasn't comfortable. It was pretty scary. And so I looked around for things that might help me with that. And I found this guided meditation specifically geared towards cancer patients on an app called Headspace. I finished the course of Headspace, and I remember using that meditation every day in radiation, and it was really, really helpful. In addition, the Dana-Farber did connect me with an individual therapist that I saw a couple times, and she was great. She was very helpful, who helped me kind of think about what my diagnosis of cancer meant for me and how to process the kind of worries that would keep me up in the middle of the night. And I also went to a couple groups. One thing that I found having cancer at about 40 with young kids was that I didn't really feel like I fit in with any of their cancer patients. So there were sort of a pediatric group. So these were, kids to college age people who had cancer, and they had a whole different set of concerns than I did. And then there were older adults with cancer who, again, had a different set of concerns. And so as helpful as the groups were, a lot of things that I was worried about, they didn't really resonate with the people I was with. I think the thing that was most helpful, though, was finding what I call cancer mentors. And by that, I mean people who have gone through the experience of having the same kind of cancer that I had or something similar. And I found a couple of them. And the one who was most helpful was a guy named Ryan, who's an ambassador with the Head and Neck Cancer Alliance. And Ryan was great. Ryan had pretty much the exact same cancer that I had. He had a very similar course of treatment. And unlike anybody else I talked to, unlike my doctors who were great, unlike my spouse, who I love very, very much, Ryan knew exactly what I was going through and how he felt in that moment. And so I was able to talk to him about my worries. He was able to say to me, yes, these were things I worried about too. This is what happens. And give me some hope that you can come out on the other side. This was really important and really helpful for me. Like Steve, I had a feeding tube. I lost the ability to taste food. My throat was really sore. I was losing weight. I was not excited about getting a feeding tube. I was actually pretty sad about it. And I was worried about, kind of getting off the feeding tube, worried about being able to swallow again. But after talking to Ryan and his experience with his feeding tube, I learned that, you can make it through this. You can get these things removed. You will be able to eat again. And for me, it was one thing to kind of, hear that from my doctors or even read that in studies, but to talk to somebody who's had such an experience was just so useful for me. And one thing that I think was also really helpful about talking with a kind of cancer mentor was this idea that when treatment ends and the cancer is gone, the anxiety is not gone. First of all, you still feel pretty bad for a while after treatment ends. And you kind of wonder, how long is it going to take you to recover your sense of taste, to recover your energy? And talking with people, you realize there are all sorts of different roads to recovery, and no road is wrong.
Great, thank you, Mike. And our caregiver panelist with us today is Kristi Mason. She is a mother, wife, and caregiver to husband, Andy. Andy is a stage 3 throat cancer survivor. He underwent both radiation and chemotherapy. During his treatment, he lost more than 85 pounds. He also experienced several side effects, including hearing loss, a lack of saliva, changes in his ability to taste, as well as numbness in his feet. These side effects lasted for months after treatment, and some of which are still continuing to be managed. Kristi, welcome. Thank you for joining us.
Yes, thank you very much. Appreciate being here. So yeah, my journey started about 5.5 years ago. And it's a little bit different from everyone else's on the panel in that I'm a caregiver. But I think the caregiver has a very important role in the recovery team and the treatment team. And so about 5.5 years ago, my husband noticed, he noticed something on his tonsil. There was no pain, nothing like that. And it just never, what he noticed on his tonsil just never went away. So he ended up going to his primary care physician, who thought it was really nothing. But that didn't settle right with him nor me. So we went to, we pushed to get into an ENT specialist, and we got to the ENT specialist, took a look at it, and within the next 3 days, they had my husband on a table doing surgery to remove the tumor. And we knew at that point that we were in for something. There was a rapid response. And so with that, you kind of already start to feel those emotions of, okay, it's something, what is it? There's anxiety already building in that moment, and you're kind of preparing yourself for the worst. And so we got the diagnosis right after they did the biopsy, that it was stage 3 tonsil cancer, HPV related. But the good news was for us that, and the journey that we were going to embark on, was that this is a very treatable cancer, and it has a high recovery rate. So to what some of the other panelists have been saying, we had sort of a North Star to look forward to, that we knew this journey was going to be tough. My husband's radiologist and his caregiving team sat him down and said, this is going to be one of the worst treatments, but it's going to be hell, but you are going to get through it and you will get better. And so, we looked forward to the day that, for me personally, I look forward to the day where he could ring that bell every day for 30 rounds of radiation treatment. He walked past this bell, and I look forward to the day that there would be one day that he could ring it. And so there was sort of that North Star and something to look forward to. And I think Gail had said it, having a positive attitude. One of the things that his doctors also said to us was that this type of cancer was at epidemic levels. And it was that sort of resonated with me, because I had never heard of this type of cancer before. So, like a lot of the other panelists, what did I do? I went to Dr. Google. And Dr. Google can be a very deep, dark place. And I would tell anybody to avoid that, because that caused more stress and more anxiety for me, because I was reading more about palliative care, and I knew that wasn't the journey we were going on. The only thing good that came out of the Google search for me anyways was finding the Head and Neck Cancer Alliance, and seeing that there was actually some positive things happening in this field and with ambassadors. So, the treatment, as others have said, it's grueling. For my husband, he went through 30 rounds of radiation, and he went through 8 rounds of chemotherapy. And during that time, over the course of about 3 months, I watched him drop 85 pounds. And as a caregiver, as he's my husband, it was really hard to watch him just wither away like that. And so, fortunately, he had a little extra weight to him, so he didn't have to go on a feeding tube. But part of what I would say to any caregiver is some of the anxiety that you're going to feel about them losing the weight. And about them going through this it's all natural, and it's okay to feel those feelings. You're going to have them, be okay with them, and let yourself feel them, and also give yourself a way to have something for yourself. So for instance, you've heard a lot of the panelists today talk about having, be it meditation or doing something physical. For me, I had to not be into that cancer mindset for even 30 minutes a day, because it was just all encompassing. It was like we invited cancer to dinner, and it was never leaving. So for 30 minutes a day, every day, I went out and ran. And I ran, I ended up running my first half marathon. I've never run a day in my life. But being physical was something that helped me just step outside of cancer being in my home and having something that I think about all the time. The other thing, Gail had mentioned this in humor. Humor played a very important part in our way to relieve stress and anxiety. So at the time we were watching Breaking Bad. We were binge watching Breaking Bad, and every day you go to your radiation treatments. I drop him off, and before he would get out of the car, I'd say, "Good luck, have fun at your cook today." And it was a reference to Breaking Bad. And there's just you have to find an outlet, and whatever that outlet is. For us, it was humor. It was just a little way to feel human. And then the last thing I would say that a lot of the panelists have said too is really set expectations. And what I mean by that is when the treatment's done, there's still a lot that happens. And so set reasonable expectations that you are still going to have some stress, some anxiety. Your person that you're caring for is going to continue to go through some things. And, and even after a year down the road, 2 years down the road, they still go to the follow-up treatments or their follow-up appointments just to do this check and the scan and make sure everything's okay. And really, that's an anxiety time for me. I think about, are we going to hear something again? Are we going to be back in that moment? So, just have the mindset that, try to find the peace that you are probably going to be managing some stress and anxiety for a long time to come after the treatment. It'll help you stay calm and level-headed because, your patient, or the person that you're taking care of needs you to be that. They need you to be their eyes, their ears, their advocate for when they can't be. And you need to have that calm and level-headedness about you so that you can step up into that role.
Thanks very much, Kristi, for sharing your experience. And thanks to all of our panelists for those great introductions and for helping us understand your journey. Now I'd like to allow our panelists some time to discuss how they managed their own stress and anxieties in a little bit more detail and give them the chance to offer some further advice for others who might be dealing with some of these same challenges. Another theme that sort of came up quite a bit as you all were introducing yourselves, and one that I don't think I see very much about in the general information or literature that's available for patients, is what happens after treatment ends. So we get all this close attention from our care team during the process of our diagnosis and treatment. And then sometimes patients feel a little bit as if they're left on their own to kind of manage their own symptoms and monitor for their own signs of progression or recurrence until they come up against those appointments where they have those scans. And then, as some of you have mentioned, those scans can be a little anxiety provoking. Scanxiety is often a term I hear patients use quite frequently. So I wonder if there are particular strategies that any of you have used that you found particularly helpful for managing that sort of transitional phase back into, post-treatment, real world sort of daily life, and, strategies. And as Gail mentioned, what things you put in your toolbox to help for, as those stressful situations come up, and what resources that you know of that might be available for others who might be facing this challenge.
Well, I can just say for me, I stay very plugged in as far as with the team I have, and I think they probably get tired of me, but, I'll take a picture if something doesn't look right, even though it's not an active situation. But if something doesn't look right, I want them to know I'm still here and I still want you to pay attention to what I might be going through or what I might need. So I will shoot a picture off from my portal if there's a concern, because the things continue to go on. The sore throats for me are constant. My taste is still very different. Also for me, I stay connected in the sense of, talking to people who are currently going through a cancer diagnosis. So it keeps me, I would say, plugged in a way, but also it just keeps me in touch with the realities of what has been and what could be. So I go to the local YMCA and they have a Live Strong program. And so I've been asked several times to go and speak to the folks that are going through that program. So I would say for me, I just stay plugged in, even though my tonsil cancer is not an active situation. And I feel for me that that's going to be my ongoing journey. So I'm not going to be morbid about it or anything like that, but my reality is that it's a part of my life and my journey. So I stay plugged in and just want to know and hear what's the new treatments, what's the new readings, have they gotten better treatment for people with the HPV-related cancers in particular, since the message has been that it's much more curable than some of the older cancers. You know, what are the new clinical trials? So just trying to stay educated and aware is how I continue to try to stay whatever it is I'm staying.
Yeah, that all kind of resonates with me too. One thing for me, you know, sometimes late at night, you begin to think and you worry about stuff, at least I do. And I really just try to stay in the moment and be mindful and say, you know, I might have cancer, my next appointment, that is possible, but I don't right now. Things are really good right now. I'm feeling good right now. And even if I do feel bad in the future, I still have this time right now and nothing is going to change that. So for me, really, really trying to be present seems to help me for that kind of anxiety.
So Michael, one of the things you mentioned that I also adapted very strongly was headspace and meditation. And, you know, at the suggestion of my doctor, you know, I did it religiously for over a year. I now I bounce in and out. Now I find myself meditation just on my own without an app guiding me through it, because you kind of learn how to do it. And that's the thing about meditation. There's no wrong and there's no right. It's just, you know, just being present. You can meditate at any time. You can meditate in the car line, wait for the checkout line at the grocery store, whatever. So, but meditation, and I'm hardcore, you know, type A lists, you know, pretty conservative, and all the meditation and mindfulness. Like, what's that? My wife thought I was going off the deep end and everything. But so some of the toolbox of things was the mindfulness meditation. But I mentioned it earlier. At this other suggestion of my doctor, I started practicing Tai Chi somewhat from an exercise standpoint, but mostly from a mindfulness standpoint. And actually, my fellow Tai Chiers were very, very supportive. And it was nice because I could let my guard down with them, you know, and I wasn't Steve, the engineer, Steve, the husband, Steve, the dad, Steve, the friend, Steve, the churchgoer. I was just Steve, you know, with them. And that was interesting thinking back of it. So also I went to counseling, both counselor and psychologist and psychiatrist. I mentioned earlier that to me, sure, the cancer had some anxiety in the diagnosis and the treatment. It was stressful, but it wasn't really anxiety because I was busy. I'm good being busy. I'm real good at being busy and active. And I was on it. I was like, just I went with whatever my doctor said. I got up just like people got up and brushed their teeth. I went off and got treatment and whatever. So that was easy. It was the reality that we've been talking about when it was over. It's like kind of hit me like a sledgehammer. And it took a year. So I buried it, you know, emotionally, which I do pretty easy. And then a year later, I was talking to a coworker who I hadn't spoken with in HR, no less, and hadn't talked to her over a couple of years, and just catched up. She says, "Well, how are you doing?" I said, "Well," because she heard vaguely that I had, "How are you doing?" And it exploded. You know, the boat tipped over. It was just a wave of emotion. It was all this anxiety and emotion. And okay, what do I do now? So again, family, friends, counseling, medication, and you know, I didn't think about bringing this up until just a second ago. So as part of that, it's in the toolbox. I called the crisis hotline. So I was a mess. You know, my wife was worried about me, and I was a mess. So I was driving home from a scan, and I was like, "Well, I should go back to the doctor because I need help." So go back to the doctor, go back to the ER. So I did, and I went home, and I was a mess. Called my wife, and you know, never done that in my life. I'm not the kind of guy that people would look to that would do that. And then, you know, they were helpful. And again, it was all VA. VA's fabulous. VA's super spectacular, very helpful, very supportive. Job was supportive, family was supportive, doctors were good. So, you know, I feel pretty good now. So, but you know, it's a journey, and glad to still be here.
Great, thank you for sharing. That shows a lot of bravery there. Kristi, any final thoughts from you that you'd like to add?
I'll be real quick. I think for me, I look for purpose. You know, you go through something like this, it's heavy, it's dark, and it consumes so much of your life. And when you come out the other side, I was like, there's got to be more meaning. There's got to be more purpose. There's more that I can do. There's more that I can give. And so for me, I did a complete 180. I quit my job. I started working. I'm now working in mission driven. There was just, found head and neck cancer. I think I was Head and Neck Cancer Alliance. And I was like, please let me be an ambassador for the caregivers out there. And I think I was one of the first to join from a caregiver perspective. I mean, so I look for more purpose and meaning and really in the things that I do too. And even to this day, when we vacation, like we really, we vacation hard. So, it was really a lot more. It was a big mental shift for me.
Wow, I'm so impressed with all of you and how you've navigated these challenging situations. Thank you so much for sharing your personal experiences with us. I want to make sure that we save some time to open up the floor for questions from the audience. And so we'll transition now to the Q&A session of this session. Thank you so much. Our first question might be best for Mike, perhaps you, or even Gail, you might wish to chime in as well, and others are welcome to also. Eric Sharp says that he's an active member of a mental health peer support group for depression and bipolar support. And he would like to know if folks can talk about how you addressed any mental health issues during the recovery phases of your survivorship journey.
Yeah, I think that's a really important topic. I think that, for one thing, when you have something like cancer happen to you, it happens to you in the context of what else has happened to you in your life. So if you're somebody who has a history of depression and anxiety, for example, that's not going away when you get cancer. It's likely to cause a spike in that. Where I work actually in my hospital, we have all sorts of, organizations set up for things like that. For me, there have been a few times in my life where psychotherapy was incredibly helpful. And that was one kind of situation, kind of both during and after treatment. And I think, that includes kind of group peer-led psychotherapy or psychotherapy groups, which I think are also really, really useful. And those can sometimes be offered through the hospital you're getting your treatment at, or sometimes through kind of other organizations that are out there.
Yeah, I think I would just add, I think that covers it, but I think, first of all, just realizing or understanding that, there's some challenges that you're going through and that you would like to get some support. So being open and transparent with yourself, and then seeking whatever help is available, and just not putting a stigma on yourself that it's not, that you can't feel whatever you're feeling, because as you go through this journey, you're going to have all kinds of feelings. So I would say first accepting whatever your emotion is, and then seeking whatever available support is out there. And, that could be a group therapy, that could be individual therapy, whatever it takes, or perhaps a support group specific to the cancer. But first and foremost, I would say you're on track when you acknowledge that, something's just not hitting right with you and you want to get some support. So just reaching out.
Great. Steve or Kristi, any other comments on that?
I could go on pretty long about that one, but so yeah, I sought out counseling, and was very helpful for me. I went in every week, then every 2 weeks, and every month, and now I see a counselor like every 3-4 months. But I also, there's medication that can help with that. My issues weren't depression. My issues were anxiety. So there's some very common anti-anxiety type medications that have very little side effects, and they played a role. But, I actually, speaking in this, I thought of this when I was hearing some of the other talking about the transition. I've had a couple of friends, high school guys I went to high school with, and then a coworker kind of thing who came down with head and neck cancer. And, I reached out to them, and in reaching out to them was actually therapeutic for me, because to a certain extent, kind of, you start to feel a little less sorry for yourself, because, so that was helpful. So.
Great.
Thank you.
You mentioned anti-anxiety medications. That we've had a couple questions come up already about use of medications for both anxiety and depression. Did any of you try medications or find those to be helpful during your journey?
So yes, Lexapro and Trazodone, if you want to know. Escalopram, I think they call it the Lexapro, but it's trade name. So those two. I might have had another one, but I take pretty low dosages of them. So I tried to self-medicate and take myself off of it at one time. That's not a good idea. So I didn't, nothing happened really, but I was like, wow, I don't feel right. So I take it as insurance. So I'm good.
Okay. Let's see. We've had another question about, after treatment, and especially once you've been through, treatments more than once, navigating a recurrence, how do you get past this feeling of a detachment from regular people, feeling like your identity may be a little bit different?
Wow, that's a good one.
It is a good one.
Who wants to take that? I would just say for me, and I always say for me, but it does feel like you're a little bit detached. It's like you're walking in this whole other world. And I don't even know how you don't have that feeling. I think that I just continue to interact with all those people that have always been a part of my life, just like I always did, but then always in the back of my mind, thinking that I am a part of this other group, this specific and special group. And, I don't know for me if I would call it detachment, but certainly I walk in this different lane that I am a person who has had cancer. And at this point, I'm surviving cancer, and I don't know if the cancer will come back. Who knows? So it is a constant. So I think that's an interesting question. And it's also something for me to think about, because you do feel like there's a disconnect, because you feel like people don't understand what you're going through.
I think too, everybody's experience is different. For me, after my treatment, I have hearing loss and I have chronic ringing in my ears, which isn't something that anybody around me can see, but I have it all the time. And so, for example, I have a cancer appointment with my doctor, and my wife might be like, "Oh, you're thinking about it." And I kind of think, well, I'm kind of always thinking about it. It's always there, and you can't see it. And that is something that I don't really know how to deal with. I'm still kind of living with it. I do think that, like I said before, trying to be mindful in the moment, experience what you're experiencing now. For me, it's, being with my kids or doing something fun. You can be more than one thing at the same time. You can be detached and be present at the same time. And I feel like maybe that's the way it's going to work for me.
Yeah, I would agree with that. From our perspective, we're 5.5 years past, and it's still there. It's still present. It's kind of part of our DNA now. It's part of who we are. And I think to a certain degree, embracing it sounds awkward, but it's made us who we are now today, and we're different people as a result of it. And I actually think maybe we're kinder, nicer, gentler people as a result, because you've gone through something like this.
Yeah, gives you a different perspective, sure. So another question that's come up: what do you wish you knew at the end of radiation as you were transitioning home? And this individual is interested in hearing from both the caregiver and patient perspectives on this.
Can you elaborate at all? Or how do we transition out of radiation? Is that the question?
That's my impression of that. Yeah, transitioning from that, phase of being actively being treated and seeing your physicians all of the time to transitioning to, follow-up care where you're not seeing your team as frequently. You're back to trying to get back to your normal daily life and or finding your new normal. What surprised you about that, or what things do you wish you knew ahead of time now that you're thinking back, Gail?
Well, I would just say briefly, it's interesting, you start at intervals. So you're every 3 months, then you're every 6 months, and then maybe once a year. So I think that I actually have felt a little bit unprotected as the time has lessened. And so I actually had an appointment last week or so with the radiation oncologist. And he said, "You're coming up on 5 years." And I said, "Does that mean you're going to be cutting me loose? Is that going to be the end?" And, I think the answer was no, not really, but maybe. So it's kind of like you feel like these people have held you and taken care of you, that you're going to miss that part. But at the same time, you want to have that part because you want to feel like you are becoming more whole again, whatever that is. So I don't even know if that answered the question, but it's a little bit different. It feels a little different as you start to taper off.
Mm-hmm.
Yeah, I can from a caregiver perspective, I'll just jump in real quick here. I remember driving home from that last session, and you feel this sense of relief, but there's times that remind you after you go through the treatment that, oh boy, the treatment is compounding and it's still having an effect. And that effect doesn't last for a day, 2 days, a week, a month. It was a solid 4 or 5 months before we got into any sort of rhythm that seems somewhat normal. So, I would say you got to give it time. And I know for me, I wanted it to be like, a week after. It was very much months after.
Yeah, I think, to be as specific as I can about like coming off radiation, one thing that everybody told me, so I really should have known, was that the period of time right after radiation is when the treatment is kind of compounded the most. That's when I felt the worst. I was so miserable, but I was done with treatment. I wasn't getting the radiation. I wasn't getting the chemotherapy. I wasn't seeing my doctors every, week or so. And I kind of felt like a little bit angry, like, oh, I'm done. I should be feeling better. But I had a lot more work to do, and that recovery does not happen automatically. You don't just kind of feel better. You do have to do a little bit of work towards it. And that was a little tough.
Sure. And it sounds like that's a very common experience, that is an interesting transition to go from actively treating into, very much survivorship mode. So I think that your experiences are all very typical. Did any of you try to use acupuncture to help with some of the side effects of treatment? This is one participant who says that they found it extremely helpful with increasing saliva flow and easing pain for them.
I've used acupuncture in the past for a lot of orthopedic kind of things, and I stopped going. But I'm actually thinking about restarting that. So it's interesting that there's someone who's saying that they find it helpful, because I'm actually going to try that again.
I found acupuncture helpful, but more from a calming effect than a specific, pain management, stress reduction kind of thing. I transitioned to just kind of a different way of thinking about things. I became more holistic, more open-minded. Such as doing Tai Chi and getting acupuncture and things like that. So acupuncture was part of a bigger, wholer approach to managing post-treatment and lifestyle, and also meditation. I also used the Headspace app. I used it this morning. So, so that's very helpful. Just do little mini meditations and stuff like that. So, but I never used to do those kind of things.
Okay. So thinking back to early in your treatments, did any of you face challenges in communication due to physical limitations, for example? And how were you able to express those feelings or make the connections you needed to get the support that you wished you had? Any thoughts on that?
Well, you couldn't physically talk very well. You know, that, I mean, the radiation on the throat, base of tongue for me, I mean, it was just horrible. So, I mean, you just wanted to leave me alone, you know, just please let's get this over with. Cause it was just a very discomforting, painful thing. But, you know, going through it didn't really bother me, you know, mentally. I was like, oh, you know, I just powered through the darn thing, but it's like, man, this is horrible. So, you know, it's funny, you know, knowing what I know now, it's like if I got it again, or it was like, so, ooh, you know, I wouldn't want to know what I know now going in, honestly, because it was, you know, it was new, but and everybody's just different. Like I've taught, as I spoke earlier, I've spoken with people who have come down with it, and I'm said, oh, you know, it's going to be bad. You know, you might need a feeding tube, and they go through it and they're like, wasn't that bad? I'm like, wow, I didn't get that one. I don't know. I don't know.
Yeah, okay.
Communication. My wife and I communicated pretty well, so that was the most important thing. And as I said, my VA doctors were beyond exceptional, so they took care of me extremely well. So
Great.
It was good.
When I came out of surgery, I remember it was really challenging because I couldn't talk. So I had the neck dissection and, you know, all the lymph nodes removed, and I had the trach and the feeding tube, but I could not talk. So for my spouse, who is my caregiver, she was extremely upset because she didn't know how to help me. She didn't know how to communicate with me. And to this day, she'll talk about how difficult it was for her. So I would have to write on a paper for a while. And the nurses at the hospital, because I was in the hospital, I think for like a week afterwards, they knew what I was talking about and what I needed. And then after all that, I needed to do speech therapy. So I did some speech therapy for a while. And then, you know, my speaking and my voice got better. I would say that it's not exactly like it used to be, because I still have problems with the letter B and the letter V. You know, trying to talk into these new remotes when you're using the TV, it never understands what I'm saying. So I always have to call her to say, you know, tell her what channel I want. But speech therapy was a bit of my process to do better with the speaking piece.
Great. Do any of you feel that there was anything specific that you would have benefited from discussing with your providers prior to treatment that might have eased or lessened some of the anxieties? It's been a while.
I can jump in here because, you know, my husband's radiologist was fantastic. I feel very lucky with the caregiving team that we had. And he sat us down for a consultation, and he spent probably about an hour and a half to 2 hours with us, and step by step told us exactly what was going to happen, what they were going to do, and what the side effect would be, and how we could treat it. And I took a lot of notes that day, and I listened to every single word. And so I would say, if you don't have a consultation, push for that consultation. And you know, it was, in particular, it was very good that this doctor had, he treats this on a sadly, on, as he said, it was on epidemic levels. So he treats this consistently and constantly. So, he was our voice of reason. And I'll tell you, everything he said, it happened. And we went through it. And, even he gave us little hints like, you're going to need, probably in every single room in your house, you're going to need a humidifier. You're going to learn how to make shakes. So there's so many things that it helped us in our lifestyle transition too.
Great. So we have just about 4 minutes left. I want to make sure we have time to let you all have any last comments that you'd like to make. And one thing that came up as we had been talking previously that I want to make sure we have time to mention is sometimes people do things that are, well-intentioned but may not be helpful for you. So as much as we've talked about resources and things that you found supportive, I want to make sure that we have a moment to talk about, to let you mention things that didn't work for you, things that you found to be less helpful than you imagined they might have been. Are there things that you want to, give as advice for folks who are listening in that regard?
For me, the creams and the magic mouthwash, a lot of that, it didn't really do anything. Yeah. It was frustrating. So I go to the doctor. I'm like, but help me. This rash, this itching, this burning. Well, try the magic mouthwash, or gargle with salt water, or rub this cream on it. And I got prescription level stuff like that, and none of that did anything. And I did it anyways because I felt like I had to do something. But it's like. I went through immunotherapy, and the biggest side effect for that was itching and rashes. It's like, can you just give me a pill to make this go away? And they couldn't, because that pill generally, or that cream, was steroids, and you're not supposed to do steroids when you're doing immunotherapy because it's conflicting or combating whatever. But it was like, that was frustrating. Hence I meditated. So
okay, good.
One thing that was hard for me sometimes was dealing with other people's anxiety and even depression about what felt like my cancer, so when my family members would be distressed, or thinking about my children and having to worry about how they were responding to me being sick, that was really, really hard. And I think the only thing that really helped with that was, again, just having connections with people who I felt like understood where I was coming from and had that shared experience, and talking to them about it, strategizing.
Okay. And then I just want to try to fit in one last question. How did you get past not wanting to be intimate with your partner because of some of the physical changes you experienced? Does anyone want to comment on that before we wrap? It's an important question.
That's a long answer kind of question, I think, because I think I can't speak for anybody else, but when I was first diagnosed and it was this HPV related cancer, I got very paranoid and didn't understand, like, historically how, when, and where. So I didn't want to. I wanted to make sure that that she was safe and there was not an issue. So we had to talk through that with the doctors, and to just get some clarity on, any risks or not having risks. So it was a conversation, and then we got past that. But initially I was just like, oh my God, what's going on? I don't want you to have no problems. I got kind of anxious about that. So, but it involved communication and talking with the professionals, particularly as it related to HPV.
Okay, thank you for sharing. Any final comments from our panelists?
I have a final comment.
Please.
I would say, bottom line for everyone dealing with a diagnosis, I say be part of your treatment plan. Be absolutely part of your treatment plan. you know, and no question is silly. You know, be diligent about it, because that's the only way that you're going to have less stress and anxiety is you ask whatever question it is you have, even if you think those questions are unusual.
Yep, there are no wrong questions or bad questions. Yeah, you have to advocate for yourself. Thank you for that point, Gail. Well, I'd like to thank all of our survivors and caregivers for your attendance. A special thanks also to our panelists, Dr. Mike Murphy, Gail Jackson, Steve Cassidy, and Kristi Mason, as well as the Head and Neck Cancer Alliance and the American Head and Neck Society for their time in organizing and hosting this webinar. Thank you all so much.
Thank you.
Thank you.
Thank you.